So in the last 10 years, the minimally invasive surgery taken absolutely off. And one company in particular developed a surgical tool. It's the only one available in the United States and in the world. It's called the Vinci surgical robot. It's a slight misnomer. This is not a robot that does surgery by itself. It's a computer remote control surgical device. So the surgeon still does the surgery. Surgeon sits a little bit far away from the patient, and the movement of the surgical hands and fingers get translated into robotic motion. The big advantage of the robotic surgery is, first of all, it allows you much more manipulation, or we call it freedom of motion, within the abdomen or pelvis for that particular surgical field. Just to give you a brief example, if we do a conventional laparoscopic surgery, we're slightly hindered by the ability to manipulate within the narrow spaces of the abdomen and pelvis. You can imagine a tiny instruments that are a straight stick going in, which is hard to compare to this type of motion of the surgical hands. So the robot allows you to do this, literally speaking. So the instruments inserted through the robotic ports will allow you to move with what's called 7-degree freedom of motion, mimicking the motion of the surgeons on the open procedure, for example. That's one of the biggest advantages. The next probably is the ability to see in three-dimensional vision. We as humans develop with 3D vision, so every time we look at something, we have an ability to establish what's closer to us, what's a little bit further from us, and that becomes important in surgery, specifically if you have a microsurgical technique where you have to do some dissection close to very important organs and you don't want to damage them. You really want to know what's a little bit closer, what's a little bit further away, and sometimes a millimeter or even half the millimeter will make a big difference. So robotic camera is developed in a very specific way, so it has two channels that allow the surgeon sitting and looking at a console actually see in a true three-dimensional vision, as if you're looking with your eyes. And the third advantage probably is ergonomics of a surgery, because you're not standing, you're not hunching over the patient for 3 to 4 hours in a complex surgery. You as a surgeon actually sitting at a console comfortably in a chair, almost like the way I'm sitting right now, and looking into a view screen, which shows me my operating surgical field. That helps a lot. So long surgeries where the fatigue becomes a major issue and potentially can lead to mistakes, eliminated with the robotic cases. You can perform any surgical procedure with a robot. We have to keep in mind that this is a very expensive machine. On average, to purchase a robot costs somewhere between $1.7 to $2 million. The procedures that require a lot of intra-abdominal, intra-pelvic manipulation. So any procedure where you think you will do a lot of suturing, which is a difficult, complex surgical laparoscopic task, are ideal for robotic cases. The procedure that you will think will take a long time, again, coming back to what I said previously, if you think that it's a 3, 4, 5-hour procedure and you as a surgeon will be standing there and prone to fatigue after a couple of hours, then maybe sitting comfortably at a console will eliminate that variable and obviously lead to fewer surgical mistakes.